welcome everybody. We are going to be focusing on investigator noncompliance and what this means from a sponsor's perspective. So throughout today's class, we're going to focus on really defining what is noncompliance. We're going to talk about some FDA findings. We're going to compare the findings across the last 3 years, and we'll see what the trends are, if any. And then we're going to look at a number of warning letters and talk about the language that's used and what we can do to avoid it. For me, one of the take-home messages is that mistakes do happen, but we have to get better at a preventative approach. Within our industry, we're always very, very reactive. We're in a very much of a hurry up, get it done, we'll deal with it later. And we have to change our approaches. And so we're going to talk quite a bit about that and what that means as well. So there's been a number of handouts that have been provided to you. I'm going to go over just 3 of them during class today, but I did want to let you know that I tried to provide you with just a wealth of different references for you to have. And so one of those, and I'm not going to talk a lot about it beyond this intro, is just that I did provide you with the quality guidance that came out from the EMA reflection paper. And this is, again, really going back to this concept of risk-based monitoring. But what they really focus on is, again, the fact that we need to implement quality from the beginning. And that really ties into, again, how we're going to manage our investigator compliance and how we're going to manage our studies. So our objectives for today are to categorize investigator noncompliance, define adequate escalation of noncompliance, to summarize proactive investigator training related to sponsors' response and noncompliance, employ comprehensive steps in compliance management, and detect trending to better anticipate compliance issues. The warning letter language we see, just jumping right into that. Why does this matter? Well, because these will be findings. And the language that we see is so often phrased in terms of, you failed. It's that clear. If we don't adhere to a protocol, if we don't submit the right information, if we don't assign the right tasks to the right people, the warning letter states, you failed. So the examples provided here are related to assuring that an investigation review board complies with the requirements set forth in Part 56, that they are responsible for the initial and continuing review and approval of the proposed clinical study. And this is for 21 CFR 312.66, but then also certainly IRB responsibilities are in 21 CFR Part 56. But what's key about this, and I think what we so often overlook and that sites overlook, is that an investigator, as part of compliance, is responsible for overseeing the relationship with the IRB. So certainly submitting documentation for renewals, approvals, informed consent, but also making sure that the IRB is kept informed, but that the information we get back from the IRB or that the site has accurately reflects what was reviewed, when it was reviewed, that the right number of board members were on there, at least that we have a current list, and that there's evidence that an investigator did not participate. So all of that goes into investigator responsibility and compliance. So if any of those things are not overseen, the language is, you failed. The second point here, you failed to maintain adequate and accurate case histories that record all observations and other data pertinent to the investigation on each individual administered the investigational drug or employed as a control in the investigation. And what's key about this is that as far as case histories go, this includes source documents, and this includes electronic medical records. So as far as compliance goes, we also have to be aware of what do the FDA regulations say regarding to electronic medical records. So what information needs to be captured? How does it need to be captured? What information needs to substantiate the details that we put into a case report form? And the last example here is you failed to ensure that the investigation was conducted according to the investigational plan. Now that could mean any type of deviation.